Hello and welcome. Today we'll be discussing tubulointerstitial nephritis, a kidney disorder that often flies under the radar but can have significant consequences for kidney function. We'll explore what it is, what causes it, how it's diagnosed, and what can be done to manage it. Tubulointerstitial nephritis, or TIN, arises from inflammation that primarily affects the renal tubules, the tiny tubes in your kidneys that filter waste, and the interstitium, the space between these tubules. The most common cause is drug-induced. Various medications, including certain antibiotics, NSAIDs like ibuprofen, and proton pump inhibitors, can trigger an immune response or directly damage these kidney structures. Infections like pyelonephritis and certain systemic infections can also lead to TIN. Less common causes include autoimmune diseases like lupus and Sjogren's syndrome, metabolic disorders like hypercalcemia, and exposure to toxins such as heavy metals. The pathophysiology of TIN varies depending on the cause. In drug-induced TIN, the medication may act as a hapten, binding to kidney cells and triggering an immune response. This immune response involves the infiltration of inflammatory sites and macrophages into the interstitium, leading to inflammation and damage to the tubules. In infectious TIN, the bacteria or virus directly damages the tubular cells, provoking an inflammatory response. Regardless of the initial trigger, the inflammation disrupts the kidney's ability to concentrate urine and maintain electrolyte balance, leading to various clinical manifestations. Accurate data on the exact incidence and prevalence of tubulointerstitial nephritis is difficult to obtain. This is largely due to varying diagnostic criteria and the fact that many cases are mild and undiagnosed. However, drug-induced TIN is estimated to account for a significant portion of acute kidney injury cases seen in hospitals. The prevalence may also vary depending on the region and the use of specific medications within that population. Understanding the epidemiology is crucial for identifying risk factors and implementing preventative strategies. The signs and symptoms of tubulointerstitial nephritis can be quite variable. Some people may experience no symptoms at all, especially in the early stages. Others may develop more noticeable signs such as increased urination, particularly at night, known as nocturia. Other symptoms include fatigue, nausea, loss of appetite, and swelling in the legs, ankles, or feet. Sometimes there might be flank pain indicating kidney inflammation. In some cases, TIN can lead to acute kidney injury, causing a rapid decline in kidney function, potentially requiring dialysis. Diagnosing tubulointerstitial nephritis requires a combination of clinical evaluation and laboratory testing. Urine analysis often reveals abnormalities, such as white blood cells, red blood cells, and protein in the urine. Blood tests will check kidney function by measuring creatinine and BN levels. Elevated levels indicate impaired kidney function. An important diagnostic tool is a kidney biopsy. This involves taking a small sample of kidney tissue for microscopic examination. The biopsy can confirm the diagnosis of TIN and help determine the underlying cause. In some instances, imaging studies like ultrasound or CT scans may be used to rule out other kidney conditions. Tubulointerstitial nephritis can be broadly classified as acute or chronic. Acute TIN develops rapidly, often due to drug reactions or infections, and may be reversible if treated promptly. Chronic TIN develops slowly over time, often due to prolonged exposure to toxins or chronic inflammatory conditions. Chronic TIN is typically irreversible and can lead to end-stage renal disease. Differentiating between acute and chronic TIN is important for determining the appropriate treatment strategy and predicting the long-term outcome. The primary goal of treatment for tubulointerstitial nephritis is to address the underlying cause. If a medication is suspected, it should be discontinued immediately. For drug-induced TIN, corticosteroids may be used to suppress the immune response and reduce inflammation. In cases of infection, appropriate antibiotics or antiviral medications are administered. Supportive care, including maintaining fluid and electrolyte balance and managing blood pressure, is also essential. In severe cases where kidney function is severely compromised, dialysis may be necessary. Preventing tubulointerstitial nephritis involves avoiding or minimizing exposure to known risk factors. This includes using medications judiciously and only when necessary, informing your doctor about all medications you are taking, including over-the-counter drugs and supplements. For individuals with autoimmune diseases, careful management of the underlying condition can help reduce the risk of kidney involvement. Staying hydrated and avoiding exposure to nephrotoxic substances can also help protect kidney function. The prognosis of tubulointerstitial nephritis varies depending on the underlying cause, the severity of the kidney damage, and the timeliness of treatment. Acute TIN, especially if drug-induced, can often be reversed if the offending agent is stopped promptly. However, chronic TN has a less favorable prognosis and may lead to progressive kidney damage and eventually kidney failure. Recent research is focused on identifying new biomarkers for early detection of TN and developing more targeted therapies to reduce inflammation and prevent kidney damage. There is also ongoing research exploring the role of specific immune cells and pathways in the pathogenesis of TN, which may lead to novel therapeutic targets in the future. Regular monitoring of kidney function is essential for individuals at risk of developing TN.